Hi, I'm Dr. YVRao from Dr.YVRao Clinics based in Hyderabad, and I'm a plastic surgeon. Today I'll be doing hair transplant for the beard region. So beard has some peculiarities regarding the direction, the type of the hair, and so many other factors to it. Just now we have harvested the grafts, some baby type of hairs from the junctions and some 1-2 hairs from the back of the scalp. Now we'll be transplanting. Before that I have injected an anesthetic solution all over and a little of saline also, so that now it's a little bloated, but that's the way it should be to reduce the bleeding and so that it will be painless also. He wanted to take a good mustache, not very dense, moderately, but he wanted a complete type of it. You can see this beard, if you notice, even the sideburns also, it is very sparse. And then even in this also, the beard should be, these are the vague markings which I made it, and then these are the markings which I am going to, and these are zigzag marks. In fact, the nature is guiding us. We have to just follow the nature. These are some of the baby type of hairs. We just follow up to that one. We don't have to go up to this region. It looks awkward, so maybe stop. And then now I made a few markings like zigzag markings. Nature, nothing is straight line. So always like a zone. It will be like a zone. And fill up. And here also, he wanted in a shape like this. So we'll be transplanting, avoiding the hair grafts in this zone. So all this area we transplant. So also on the other side. So now we'll start. Having infiltrated the fluid, now we'll make a start. There are two methods. One is of placing the grafts. One is a slit method, the other one is stick and place method. I use the slit and then followed by graft placing, not the stick and place. Stick and place means make a hole with the needle and then place the graft immediately. Whereas in slits, preformed slits, some make with a single slit like this, some with multiple blades, but I prefer somehow the single one. And then in the direction of the hair, here the density, the three factors play major role. One is the density, the other one direction, and the type of the hair that we place. In the central part, we try to place 1 to 2 hairs. On the junctions, preferable to place the baby type of hairs from the almost the lower part of the head. We take from the lower part of the head like that. That is just above the nape of the neck. That type of baby hairs, we keep it for the transition zone. So we'll start from the side parts. Right. Pass. The side bone also should not be very wide. It usually depends on the build of the individual also. So for guidance sake, I have drawn the mark, which that means I should not cross this boundary. And any graft should not be placed on a side by side. It should be placed in a little irregular. You can see in the movies they place it in a oblique fashion. So if you place like the hairs like this in an oblique fashion like this in a rows, it will give a deceptive appearance of a increased density. So we try to go in between the hairs and try to increase the density. That's what he wanted. So any zone, it should be like a zone, not in a straight line, even at this side also. they should be irregular. That means one hair projecting beyond like this. You can see this is a zone. There is no clear line like picture. Irregularly rector placed. Likewise we place them. So you can see it is not at the junctions intentionally I made some irregularities here and there to give that naturality appearance. And like, as I was mentioning, the density part, it should not be too dense also. In fact, he doesn't want very much dense, because we have to reserve some hair grafts for his future baldness also. At present he is not bald. In case he becomes bald, if you try to exhaust all the hair grafts, he will not have any hairs for the coverage of the scalp. He wants more concentration in the sideburns, so that's why I'm trying to give more hairs in this zone. Sorry. So if there is any bleeding, we try to press it for a few seconds, few minutes rather. Most of the times the bleeding stops. So I'm just filling up all this area. Just follow the nature. So I was just mentioning that if you press it, most of the bleeding stops. That's what I was mentioning. This correctly. So we can see the direction of the hair also. It was coming like this. Now it started going like this. So this is the zone of merger. So where we give it smooth transition like this, instead of abrupt angles like that. So if we just carefully follow the nature, we get good results. There's no doubt about it. So I'm making slits in the proper chin region. Pike. Some more. So this is what direction, apart from the density, another important aspect is the direction of the hair. So as we go to, again it goes like this. Some people use angled ones, some people use straight slits, so it all depends on. I usually use around 1.2 millimeters width slit, and angled one, 45-degree angled one, which somehow I prefer. In my hands it appears to be better. So into this is after making the slits, then we start implanting the actual hairs. Till that time they will be placed in a PRP solution and put them in the refrigerator compartment for a few minutes. So transplanting on the beard and mustache is slightly difficult and time consuming. The reason there is no stability here. The tissues keep getting wobbled up. Whereas here, when you're in the scalp region, there is a stability, there is a stable bone, and it's a wider area. Here it is narrower, and then multiple curves are there. And cheek, there is no stability here. It wobbles there. So now you can appreciate, because I applied medical grade ink so into the slits, you can appreciate the slits better and in the direction of the hairs in a zigzag way. He wanted in this zone a little more moderately in this zone, so that's how I place it. In between, if there are any things required, we'll place the grafts with the slits or with the stick and needle place method. So the same step on the other side.